bags are so much. Y'all have left no room for me. Yes. Ladies and gentlemen, I want to thank you for being here this morning and to facilitate my being able to speak to Barbadians today. I've just completed this morning a briefing from my Minister of Health and with the Chief Medical Officer and the rest of his team. And I regret to have to advise Barbadians that there have been further developments with respect to the virus and the test results. As of midday today, there are 3 new cases that have been confirmed, 2 for Barbados and 1 which we facilitated for a cruise line. The first case today was the spouse of the visiting female who was one of the first 2 people to be tested and found positive 2 days ago. The gentleman, I'm told, never left her side and was in isolation with her even when she went into isolation as soon as the testing was done. It's therefore no surprise to the medical officials that he has tested positive. The second new case was that of a 60-year-old Barbadian who arrived on the weekend, I'm told, from New York and who developed symptoms soon after arriving in Barbados. We had been monitoring him for a few days, and he also has tested positive. The third individual is a request from the cruise lines, one who has never lived in Barbados and in fact has never been to Barbados. I'm told that he was in isolation from the time that they started to feel bad, and the cruise line asked us if we would facilitate the testing of him in order that they may take the appropriate precautions. In all 3 instances, we have acted in a manner, as I've told you, that we will continue to speak to the Barbadian public and to share the information as we receive it. With respect to the first 2 cases, there is a significant amount of contact tracing that is still being done, particularly with the Barbadian who came in on the weekend, and it is too early for the medical officials to advise us as to the results of that contact tracing. They have advised me, however, that they have tested the other Barbadian who was tested first, and the contact tracing with her family has suggested that they should also be able to have results later this afternoon with respect to her husband and 2 children. The good news being that she literally did not go anywhere once she landed. With respect to the cruise ship, this morning I gave instructions that there is to be no shore leave, and the chairman of the port is here with us. And I also gave instructions that we will continue to facilitate the persons who are disembarking the ships to go to the Grantley Adams International Airport only in order to be able to take their flights out. I've been advised by the port that the last flight for those persons will leave on Sunday, and with respect to the rest who remain as crew, as I said earlier, there will be no shore leave. We have an obligation to these ships call Barbados home, and there is a legal and contractual and moral and ethical and humanitarian obligation that we have. I will say to you that we did receive a request, for example, last week with respect to being able to test for 5 or 6 cases, I can't remember now, on board one ship, and we refused. And we refused then because we did not believe that we had the capacity, because we had not yet stood up our Defence Force Field Hospital. We only had the limited beds at Enmore at the time, and we believed that it was too many for us to take at once. We acceded to the request yesterday to be able to test this single person, crew member, and regrettably, that test, as I just said to you, was positive with respect to him. We have also taken a decision, given the fact that these cases that have presented themselves with Barbadians have come from New York, that any persons arriving from the USA, from the United Kingdom or Europe will have to quarantine or self-quarantine if they are Barbadian for 14 days going forward. This morning, we spoke to JetBlue and American Airlines, and in both instances, we indicated what we would be taking and that this self-quarantine and quarantine arrangements will be for all persons arriving from Sunday, the 22nd of March. That is to allow people to be able to plan out their business. As you know, you can't announce now for now because you're dealing with the movement of people to and from Barbadians coming home, as well as persons who are already on island who are choosing to leave the country. Against that background, we anticipate, as we have already been in discussions with them, that there will be a continued reduction of services. I think after the 7th of May, American Airlines will probably not, after the next week, they will not be flying until early May again. The Minister of Tourism will give further details in the next few days, but we anticipate that there will be a significant reduction in services. We were already advised with respect to Canada, and we know that WestJet had finished, and that we have, WestJet finishes on Saturday, and Air Canada will finish within 10 days or so. So that the bottom line is that we do not anticipate that there will be significant numbers at the airport. Why are we not closing it completely? Because at the end of the day, this country still needs to be able to have access to the international world, whether it is for emergency supplies, medical, emergency parts, various other things. But we anticipate that the level of flights coming in and out of Grantley Adams International Airport will significantly reduce going forward. Yesterday, I met with members of the private sector and the union movement, from hoteliers down to taxi drivers, from PSV operators to commercial retailers and supermarket owners, from persons generally who are managers or owners of capital in this country, to vendors as well, Barvin. We met with a wide cross-section of the private sector and all of the representatives of the union movement. And I am happy to report that for the most part, we understand the difficulties. Their view overwhelmingly, 90%, was that we should not shut our borders fully. Shutting our borders fully has implications for the movement of cargo and has implications ultimately for the movement of people. But having said that, we anticipate a significant reduction of commercial air flights for passengers in particular. And also, as the port would have told you before, these ships to them because of being a home port. I also want to address the issue of the fact that we have to come to the reality that there will be a large number of Barbadians who will get the virus. But I want to say to you that that large number, the overwhelming majority will only have mild symptoms. And in many instances, I'm told by the doctors that those mild symptoms will not even present themselves as something that people may even go to the doctor for. There will be a few who will require medical treatment and medical advice. And there will even be a smaller number who may require to be placed into an isolation facility and to have the full serious medical treatment that goes with that primary care isolation facility that we're developing. I have talked the country through this on many occasions for the last few weeks now. That is why a country in an IMF program is spending $30 million to be able to ensure that we can significantly expand our hospital capacity and our medical treatment capacity, both in terms of primary isolation care, secondary isolation care, and quarantine facilities. We are in a good shape to be able to start to face this. What is necessary in accepting that large numbers of Barbadians will get it is for us to remember that when we last met on Monday, I advised that those persons over the age of 70 really need to listen to our advice and to stay home as much as possible. I want to repeat it because the vulnerable population is where our concern is. I would like to think that I'm strong and able-bodied, so I'm good, and the majority of us in this room. But we do know that persons over the age of 70 and persons who have underlying conditions, particularly asthmatics, particularly people who are bad diabetics, people who have cardiovascular problems that are of serious concern to their doctors, people who have chronic respiratory disorder. These are the persons who we would wish to consult with your doctor and to have your doctor advise whether you ought to also consider staying at home as part of the vulnerable population. If your doctor tells you yes, then I suggest that you get the letter from your doctor and that you share it with your employer if you're working. I've already, for those who are public servants, given instructions in the public service for us to deal with those persons who feel that they may be vulnerable after consultation with their doctor. This is our reality, regrettably, but it is the global reality. There is virtually no country in the world who is escaping this. And the bottom line is that if we who have to carry the weight for those who cannot come out are not prepared to do so, then we are in trouble. But I have every confidence that the average Barbadian is prepared to carry the weight, recognizing that they don't want their mother or grandmother or their grandfather or their great aunt or their great uncle to be on the front line, and that those were the same people who took care of us when we were young, who made sure that we didn't come into harm's way, and that we can do it for them now. Now, how long will we be required to do it? Probably until there's a vaccine. And that's why I said 12 weeks in the first instance. But if there is no vaccine, as we're expecting there probably will not be, that will be extended. But it just means that they become accustomed to a new reality, and one that is cloistered in a sense. I said that for those of us, for example, who can buy groceries for them, who can bring food for them, it means that you still keep your distance, you don't go in the house. These are the things we have to talk through the public. And I want to say to members of the media and to, as I said, to my cabinet and to the public officials, sometimes we believe that people hear us after we speak once. That is not the case, and more so now. So I want you to help me repeat the warnings to those people who are over 70. There are some who don't listen to radio. There are some who don't have social media. There are some who don't have the phones. So we have a duty to get the message to all who we know, all who we love, and to tell them, you really, really, really have to. The rest of us, we can manage. And if we get it, it'll be mild for the most part. We believe, therefore, that we have a duty to continue to share this with Barbadians. And I want to say, look, more than any time, we have a duty to be disciplined and to listen to the people who you need to listen to. I listened to this man here or his other alternative, Dr. George, who is not with us today. I listened to the other medical officials. I listened to the Port Health, because not only at law are they empowered, but in reality, they are the ones who have the knowledge. I equally listen to all of the other advisors that we have with respect to mobility. And Mr. Carter, who you know is my czar, has been brought on to be able to help us with this social mobilization, because the truth is that a large number will get it. But a large number will also have it mild. And to that extent, once they get it and they build up the immunity, I expect them to continue normal activities. There's some who will get it later and some who will get it earlier. The bottom line is, however, that we have to be disciplined and listen. And in this, everyone is as important as the other. The gas station workers are as important as the persons who are also going to serve us in supermarkets to get food. They're as important as the nurses who are required to be on the front line, not just for COVID-19, but people have other conditions now that they still need attending to. The police have to help us keep law and order, and against that background, I want to warn people of people who are trying to be fraudulent and pretend to be ministers asking for money, as one tried to do with pretending to be Minister Bostic this morning, calling around asking for supplies. Trust me, if the government is asking for anything, you will know and it will come officially. But do not allow banditry to intrude into the affairs of this country at this time when we need people just to be safe, to be disciplined, and to get through this period. I am satisfied that we will get through it, and we will get through it well. Our duty is to make sure that we minimize and contain as far as possible, but at the same time, that to the extent that people need intense treatment, those very, very few, and when I say very, very few, I mean that we have the capacity to do it. And that is why for the last 3-4 weeks we've been at Harrison's Point, and for the last 6-7 weeks we have been in St. Lucie at the other Elaine's Canterbury and the St. Lucie District Hospital, as well as Paragon. We are not ideally where I want to be, but we are pretty much there. And I say that because we are still taking in equipment as we go in order to be able to amplify. And Harrison's Point, as I told you, will finish in about 2 to 3 weeks. I don't know if there's anything else that we need to say at this stage. The matter is available for any questions that you may have. When the Minister of Tourism finishes dealing with all the airlines in the next day or two, he will give the country a fuller update. But suffice it to say that because of the quarantine that we are imposing from Sunday, the 22nd of March, I anticipate that there will be further cancellations on those flights for people who are not Barbadian wanting to come. But those who are Barbadian want to come home, and we need to be able to allow them to do so. Any questions? Yes, sir.
Thanks very much. Could you say where the ship originated from that the person requested the testing?
Not sure where it came from. Are we in a position we'll get that information?
And could we provide?
I must tell you that in these things, it matters not where they come from. It matters simply that we give them the thing, because they would have been out there. They asked an isolated demand and asked on the basis of a humanitarian need, could we provide a test, because they cannot test people on the ship for the COVID-19.
Could we get an update as to how the 2 first cases are doing?
I think they're doing reasonably well, no? Absolutely. Come and speak, because sure. I don't want to speak as a doctor, because then they will say that I haven't paid my medical fees for the year.
So the first 2 cases were both female. One was both were admitted into isolation. One was admitted into isolation at the Enmore facility because they had an exacerbation of a long-standing problem. We assessed the situation to be mild from then. The other person had symptoms of an upper respiratory tract infection and could even have been managed as an outpatient. But obviously, because we want to contain the spread of the virus that causes COVID-19, this person was admitted to isolation.
Any other questions?
Prime Minister, a 2-part question.
Yes,
know
sir.
that we are at 6 cases.
6?
Well,
How
3. Sorry, 5 cases, Prime Minister. Sorry. Five cases.
You were counting like somebody else.
Now that we are at 5 cases, do we remain in stage 1 of the preparedness plan?
Once again, we are very clear. The minute that CMO determines that there's community transmission, human-to-human transmission at a limited level, we go to stage 2. We're not yet at that stage, but by the same token, as I said, we have been preparing because we recognize that stages can change at short notice. The other thing that I want to say is that this thing is completely fluid, and you only have to look at the international media to see that everything is changing as we speak. I'm not going to address today the economic or financial losses. I'll do that tomorrow when I wrap up the second reading speech, and therefore I'll ask you to reserve those comments or questions on the financial losses and the economic business and a job and business survival package that I will start to speak to tomorrow. But at this stage today, it is about telling Barbadians about the additional restrictions that we're putting in place, and to continue to ask those in the vulnerable groups to please, please, please adhere to our requests. I don't want to, but I promise you, if we have to, we will go to Parliament and pass legislation to keep them at home. But I don't want to at this stage, because the truth is that the feedback we're getting is that the majority are in fact adhering to the warnings. And I want to thank those businesses that have put special arrangements in place to facilitate the elderly. I saw it with respect to some supermarkets, but we're also saying, as Minister Ford did last night on CBC TV, with an excellent job, that her ministry will be leading the effort to be able to help us facilitate whatever we have to do with the elderly, but against the background that the most effective support is family, community, and church, ultimately, to be able to support persons who are elderly. People need to know and be comfortable with who they're dealing with. So we're just putting the arrangements to help make sure that that can happen en masse. Yes, sir. Anything else?
Prime Minister,
Keith?
just before coming, there was a report that we received that there was a Barbadian who attempted to enter Canada that was tested positive for the virus.
I have no such information. If you're talking about something on social media, about somebody passing through Barbados, CMO, you've received any formal communication? Minister? None. And I have made it a habit not to comment on things that are not the subject of formal communication as it relates to matters as serious as these. Okay?
The private sector, Mr. Clark, has suggested that maybe in a couple of days we may see members of the private sector, sorry, Prime Minister, asking that the only non-essential staff be able to come to work. Have we reached that stage where probably we
Not
might
yet.
see?
As I said, right now we are just focusing on the vulnerable group. And until we reach the other stages, that is not a matter that we're going to be focusing on. When we do, believe you me, these are the people who call the shots on this one as to what stages we're at. You understand? And we have to listen to the medical staff as to what stages we're at. I'm not playing. I'm not getting in this. I've given the country my assurance. I've spoken to the cabinet. We've agreed that this is how we're dealing with it. We've also spoken to the Barbadian private sector and labor movement yesterday at all levels. And they have also agreed that we can fight this together as a nation. Look, every time this country has come together, we've withstood, and I'm going back from the 19th century into the 20th and coming forward. We have always succeeded. The one thing that cannot happen is people breaking rank. The one thing that cannot happen is people deciding that they know better than anybody else and that they're talking on their own. And at some point, not now, if it becomes a threat to our stability, then we will have to take the necessary action. My job as Prime Minister of this country is to shepherd this country safely through what is now coming to be regarded as one of the most significant events in 100 years. And the last Spanish flu was 1918 to 1920, and the reality is that the world has not seen anything like this since then. Now the problem is, as I said, the majority are overwhelmingly going to be mild, but it is the high level of contagion that has people worried. And to that extent, those who are vulnerable, even if they got it, the chances of them getting even worse would be minuscule. We're saying don't take the chance. If you're over 70, don't even take the chance. Just stay home and rest yourself. Read some books, let the breeze come in on you. Watch some TV, use the phone and talk to some people, cook some food, do anything else, but don't come out generally on the road if you don't need to. Okay, treat it as a long vacation. Yes, ma'am.
Yes, Ms. Prime Minister, will we be doing the batch testing twice daily as per norm? And also, or will we be testing more frequently going forward?
CMO?
So we're going to continue daily testing. We would have explained previously that we're testing twice a day, and that is going to continue until there's a demand for increased testing. And then we would have to reassess our processes and protocols where that is concerned.
You realize that the majority of people in the world are not being tested. That's the bald reality, and the testing tends to be reserved for those who are really getting more serious for the most part. Having said that, I advise the Minister of Health to procure another 50,000, 25,000 and 25,000, and I think yesterday he briefed you that 5,000 are coming in early April and another 20,000 thereafter, and that they're trying to settle the arrangements for the other 25,000. So look, Barbados is so small that it's really one family. And that's why I'm talking in this way. Others may have sent somebody else to give that news today. I felt I had a responsibility to come and talk to the Barbadian public. Because when all is said and done, there's one Barbados. And all of us are in this together. And to that extent, therefore, we're going to talk things through. It's fluid. Things are going to come back. We're going to have to deal with things as they creep up. In life, you don't ever know every combination and permutation, but what you must know is the values that we stand for and the kinds of decisions that we will make based on those values. And that is what I've tried to re-emphasize over and over, whether in dealing with the economy, whether in dealing with other aspects of the governance of this nation, and certainly now in dealing with this pandemic. There are the financial and economic issues which they're serious, and I will deal with them tomorrow. And we have to make sure that we do not become singularly focused on COVID, such that we forget that people have other issues and other problems in this country. And those other issues and those other problems can be equally destabilizing for a person or a family. So while others have the luxury of being able to focus on a one-legged horse, I have to focus on all of the issues facing this country, whether it is that people have been otherwise struggling with unemployment, whether it is that people are struggling with other forms of abuse in their family, whatever it is, because these things also affect people's lives in the same way that COVID will affect it. The difference is that COVID will affect just a very small minority in a serious way that will lead to hospitalization of some type or another.
Second question as well. How many tests have been done today since the 11 from yesterday?
Since the
11 from yesterday.
So what I'll tell you is we've done 70 tests so far. And that was up until the end of yesterday, and we'll probably do another 10 to 15 tests today. And we are meeting the demand.
And believe you me, I want to say that from listening to the doctors, I've learned more that really and truly every person who believes that they have it or that they have a cough is not necessarily ready for a test, correct, Anton?
Correct.
And that there are other symptoms and other things that the doctor considers before determining whether the person ought to be tested or not.
Dr. Bess, just some numbers, if you can clarify. The spouse of the visiting female who tested positive, do you have an age for that male?
That male is in his 40s.
In his 40s? And the cruise line individual, do you have an age for that male?
In his 30s.
In his 30s. Do you have a nationality for him?
No, we don't.
Okay. Thank you.
Okay.
Just have one question for Minister, the social aspect of this. Meeting with a number of principals yesterday and students. With the closure of the schools, now you have a situation where some of these children apparently don't have access to, well, since there's no school, no lunch, some of them use lunch as dinner when they get home. And in reality, some of the people were crying yesterday saying, with this thing that there's a social aspect to it. I just wonder whether
we
there's
spoke to that all week, and that would have been one of the primary concerns of the Minister of Education with respect to the schools. We are going to have to find ways, as school was going on vacation next week anyhow, and the reality is that we will use the vacation period to determine how best to deal with the arrangements when it is due to start back, particularly for those who are due to have exams. Okay?
Hi, I know that suggestions have been given for persons who think they might have symptoms to not go to the QEH. You're trying to separate the Queen Elizabeth Hospital
As far
from
as
quarantine from quarantine isolation. But are there any plans to limit the visits to the QEH going forward?
I think that is part of the protocol in the different stages, Dr. Bess?
Yeah, absolutely. From now, we're asking people who have respiratory symptoms not to go to the QEH, to call ahead. You can call the hotline number, or you can call your regular healthcare provider to be advised as to what to do. And you'll be assessed and given the correct advice.
Okay, but the blanket prohibition, we had already established that persons in groups could not go to geriatric hospital or to elderly senior citizens' homes. But there is in the protocol further restrictions that will come once we move to those different stages. Okay?
Limitation has already started for visitation.
But not prohibition. But we may face prohibition in the future. Any more? Look, let us go through this together. You all in the media are a critical part of the communication, but do not let us believe that everybody reads papers or watches the news. or even read social media. And I'm asking all Barbadians, reach out to your friends, your neighbors, your family, and have these conversations. I am going to continue along with Jeffrey, who has really been carrying a significant amount of weight for us on this matter, and I want to publicly thank him. The Minister of Tourism will speak in a day or two with respect to the other arrangements. The chairman of the port has also given me the assurance that she had conversations this morning with the cargo lines and with the ports in Florida to be able to ensure that we can continue to have access to things. And that's why when people talk about closing the borders, why you cannot take a blanket decision to just close your borders, because in any event, opening them back up doesn't just happen with the twiddle of a nose. So we need to make sure that the things that we need as much as possible to keep normalcy. Will it be normal fully? No, it won't, because the mere fact that people are staying at home who constitute the vulnerable means that it's a different reality for them. Will the rest of us have to carry the weight while we are not sick? Yes, we will. Can we do it? Yes, we can. And will we come out of this successfully, ultimately? Yes, we shall, but together as one Barbados. So thank you, and God bless you all. I do want to say one other thing, sorry. I received some calls from a number of priests today, and they've all asked for a day of prayer, and I'd like to advise that we are going to agree that on Sunday there ought to be a day of prayer for the whole nation as we embark on this new uncharted territory. And I think that it doesn't necessarily mean that people have to go to church in the same way, but wherever we are in Barbados, and they will announce those arrangements themselves or through the Minister of Ecclesiastical Affairs, wherever we are, we will have that Sunday as a day of prayer, because we know that for the past 300 years, the Lord has been our people's guide, with him still on the people's side. We have no doubts nor fears.
Madam Prime Minister, I want to know if you would give any advice to employers who are already cutting their salaries and the hours of employees' time by 50% in light of...
Let me deal with that tomorrow. We're still gathering information from the Barbados Employees Confederation, from the Barbados Hotel and Tourism Association. The truth is that the United States of America, which was claiming to have one of the most successful periods of growth under the president in recent times, has even found that it too is rocking, given the level of losses. And quite frankly, there's much discussion globally as to whether we have moved from a recession to a depression. And that's a very technical term, but as we all know, the Great Depression that took place at the end of the 1920s completely destabilized the global community, and also many, many families and many, many businesses. We are in a time of uncharted territory for us, as I said, more so than any other time in the last 100 years. But we can get through it. I have every confidence of that. We're not in a sci-fi movie. We can get through it. Thank you very much. Thank you.